So I'm presenting today aging and the care ecosystem in Tunisia. I try to talk briefly about the situation. As you can see in this slide, the life expectancy at birth in Tunisia increases fastly compared to other countries in North Africa and even in Africa. So there is a big difference in the life expectancy between our country and the other countries in Africa. So population are getting older everywhere, but it's more fast in our region. So in North Africa and Tunisia, we have a demographic transition, which is already in the stage 3, but at the same time, there are little attentions devoted to that issue. The number of older persons is predicted to more than quadruple by 2050. As you can see in this pyramids, the change of the profile of the pyramids in North Africa from 2020 to 2050. So there is really a big change in the profile and the demographic profile of Tunisia and North Africa. Aging in North Africa is the result of many contributing factors. And we can especially talk about rapidly declining infertility rates, especially in Tunisia. In one generation, we move from 7 children per family to less than 2 children in family. And I am in this really generation coming from a family with 7 children to have only 2 children, and most of the time the children leave the country to work, especially in European countries. So there is also rapidly declining in death rates and an increasing life expectancy, and as a consequence, rising of the median age. This is the median age in year of the population in North Africa, and as you can see, Tunisia is the first country, so it's aging more fastly than the other countries in North Africa. And this slide shows the situation also in Tunisia. The number can triple only in 13 years. And when we compare with France, they take to triple only 42 years. So we are aging very fastly compared to European countries and to the other region in the world. As consequences, we have an increase in the prevalence of a number of long-term chronic conditions like diabetes, like hypertension, dementia also. Physical and mental disability increasing fastly in the region, and we have also an increased personal care needs. In the region, we suffer also, like other regions in the world, from the urbanization, changes in patterns of fertility, changes in family structure, including living arrangements. Even if we have Islam as our religion, family structures changes rapidly in the region. There is also the problem of migration of younger population in Tunisia and in North Africa, but it's really after the revolution a big problem because all young people leave the country. So as consequences, also we have the increase of dependency ratio and at the same time, the change in family structure, as I said, for especially Tunisia. What's about the role of family? There are also changing family structure resulting in shrinking social support networks that many older have depended upon for generations. With increasing urbanization, this support network is being dismantled, and this really a big problem. With a rapidly increasing new category of neglecting elderly individuals or older adults living alone without any caregivers. This is the situation for most of our older adults suffering from poverty, from abuse, from vulnerability. And this is the result of the revolution, the COVID situation, and the economic situation with the social and policy situation. Key roles and responsibilities of men and women in Tunisia. So, men and women in the context of population aging are varied. And as you can see in the other Arabic countries, Islam also places a considerable duty of elderly care, particularly financially and male sons. But most of the time, the situation is more complicated, and there is a recent evidence in North Africa and Indonesia that older people are increasingly playing the role of caregivers as much as they are care receivers. The role of women in long-term care provisions, as all the Arabic countries and the MENA region, women provide most formal and informal care, the most common form of care provision with the region, and even when hospitalization, women have really a place to take care about older adults. And at the same time, with the change of family composition, we have the increase of the seniors' charity homes. The majority of these homes are unorganized, do not respect human rights, and overpopulated. In the first conference with Professor Tarek said that in Oman, Sultanate Oman, there is only one. The situation is completely different in North Africa and Tunisia, particularly because the number increasing and there is no control for this seniors' homes. And I try to interpret what has the last king of Morocco, Hassan II, said. The day we open the first nursing home in Morocco, our society will be in the process of disappearing. But perhaps this is the situation in North Africa and Tunisia and the most Arabic region. Aging and pensions coverage in North Africa countries. Professor Sarah said a lot about the situation, economic situation of older adults. There is no protection, social protection system covering a small proportion of the population. Pension system covering fewer than 20% of older adults for retirement. The elderly, particularly older women, represent a very vulnerable population. There is nothing planified in Tunisia for this population. seniors in most cases do not enjoy pension healthcare coverage. Barriers to healthy aging in North Africa. There is lack of accessibility, inadequate of absent services. There is lack of consultation and involvement. So there is really no planification in this region, especially on post-revolution in MENA region, but especially in North Africa and in Tunisia after the revolution. The situation of older adults changed quickly in the negative side. Though, so main causes for the uprising in the region, bad governance, young unemployment, lack of freedom of opinion, food price and the increase of poverty, especially for older adults. So the situation increases the bad situation of older adults in the region. Many challenges to improve the situation of older adults. First of all, we need to place older people at the center of healthcare. Second, we need to develop the long-term care workforce, ensure the quality of long-term care. Third, support healthy aging, combat ageism. And finally, improve understanding of the health states and the need of older populations. And finally, thank you for your attention, and many thanks for Professor Shireen to give me this opportunity to talk about Tunisia and North Africa region. Thank you.